against AIDS, malaria and tuberculosis.
The Global Fund, which was set up 10 years ago to fight the diseases, has hit financial problems as donor countries are under pressure from the European debt crisis, and they're pulling out their funding. Rob Lake is the Executive Director of the Australian Federation of AIDS Organisations. He joins us now from Sydney. Thank you very much for your time. Can we start by going back 10 years and telling us what has been achieved by this Global Fund in the last 10 years?
It's hard to specify exactly, but by now, after 10 years of the work of the fund in HIV, in TB and in malaria, we have seen significant research, and we've seen some amazing outcomes around treatments. In HIV, it's estimated the work of the Global Fund is saving about 100,000 lives a month, and we're getting close to about 40% access for people with HIV in developing countries to treatments, and we wouldn't be there without the Global Fund.
And what is the great scientific breakthrough last year that could effectively have AIDS treatment preventing the spread of the virus sometime?
I think last year we got really the evidence we need that not only does making treatments available to people stop them dying and improve their lives, but it also dramatically reduces the infectiousness, so that the ability to pass on the virus to someone else is reduced by over 95%. So that's amazing news.
And so tell me, in the last year and a half, what's been the situation with funding from around the world? In November last year, the Global Fund announced that the planned round that would begin in 2012 November was going to be cancelled, and that was because of the financial crisis in Europe and amongst donor countries. So that meant that while the fund is able to continue the money and the programs it's got underway already, it's not able to ramp that up. And one of the major commitments that was made at the United Nations meeting in 2011 was that by 2015 we would be looking at least 50% of people with HIV around the world being on treatments, and we won't meet that target without the work of the Global Fund. So what's the situation, and what has been the discussion with governments then, particularly the Australian government?
I mean, the Australian government has, we're really proud of the work the Australian government has done, of its commitment between now and 2014 of $200 million. What we're asking is that the government bring that money forward, the 170 million of it that's planned for future years, to bring that forward so that in this current moment, really, where the fund is really unable to be confident about its future funds, that we can we can see a statement of support from the government. We heard yesterday that Bill Gates has announced that he's contributing $750 million into the fund, and that's his statement of support. And we'd really like to see the government, by bringing this forward, this already budgeted money, make a similar commitment.
And you must wince when you hear the news coming out of Europe and the World Bank forecasts and news like that about the future of the economies.
Absolutely, absolutely, because these are really practical things that are working, and we're starting to get momentum. We're starting to see that people believe these things can change, that in developing countries people are seeing the results for themselves. The next step is countries themselves taking a stronger role in funding, and that transition is being led by the Global Fund. So we really just need to keep working, that the fund can do the work that it was set up for.
Rob Lake, thanks for alerting us to the situation this morning, and we appreciate your time.
Thanks, Paul.
The founder of the company at the centre of an international scare over faulty breast implants has been arrested